Maryland Down Syndrome Advocacy Coalition 2024 Voters Guide. The Maryland Down Syndrome Advocacy Coalition advocates for laws, regulations, and policies that improve the quality of life for people with Down syndrome, as well as the family members and professionals who support them. Website, marylanddsadvocacycoalition.org. Email, marylanddsadvocacycoalition@gmail.com. Facebook, at Maryland Down Syndrome Advocacy Coalition. Instagram, Maryland DS Advocacy Coalition. Join us. MDAC member registration. MDAC Guiding Principles. Childcare and early intervention. Families need good childcare they can afford and quality early intervention services. Civic life. People with Down syndrome are able to participate in all parts of community life, like voting and speaking out on important issues. Education. People with Down syndrome are always learning. They should be able to go to good public schools from elementary to high school and to college if they want. Employment. People with Down syndrome can work in the community for good pay with the right support and opportunities. Healthcare. Everyone with Down syndrome should have fair access to good physical and mental health care. Home and community-based services. Services and supports should be easy to get, flexible, and fully funded. Housing. Adults with Down syndrome should control where they live, who they live with, what they do each day, and the opportunity to rent or buy their own homes. Making choices. Every person with Down syndrome can make their own decisions about their lives. Justice. People with Down syndrome and other intellectual or developmental disabilities deserve to feel safe, understood, and included in the communities in which they live. Transportation. Transportation, including public transportation, is important for people with disabilities to get to work, school, healthcare, and be part of the community. Information for Maryland voters. General information, important dates, voter registration, how to vote.
MDAC principles, current developments in Maryland, and questions for candidates. Childcare and early intervention. Families need good childcare they can afford and quality early intervention services. Children with Down syndrome typically have delays in mobility and communication. Early intervention services are essential to their development. Services from therapists, medical professionals, or teachers can begin anytime after birth. The sooner services start, the better. Inclusive environments with typically developing peers are especially important for young children. As Vanderbilt professor Eric W. Carter has said, early segregation does not merely predict later segregation, it almost ensures it. Finding and keeping childcare is a challenge for many families. Most childcare providers must make reasonable accommodations to their programs so that children with disabilities can attend. Shortages of speech-language pathologists, SLPs, and other early intervention providers are delaying young children receiving the services they need. Expansion of high-quality, inclusive pre-K and public and private settings should benefit and be accessible to children with disabilities. Ask a candidate. How would you make it easier for families with children with disabilities to find and keep childcare? How can we increase the number and diversity of early intervention providers, including physical, occupational, and speech therapists? Do you support fully including children with disabilities in the Blueprint pre-K expansion so that all children have equal access to high quality, inclusive pre-K programs in public schools and from community providers?
Civic participation. People with Down syndrome are able to participate in all parts of community life, like voting and speaking out on important issues. Accessible voting is critical for our community. Mail-in voting, early voting, and accessible polling places and ballots are important. We look forward to having opportunities to talk to candidates, to spend time with our elected officials, and to share our concerns so that those running for office and representing us have information about our lives and experiences. Ask a candidate. How can we ensure that people with disabilities are able to vote without barriers and with the support they need? We thank our elected officials and those running for office for their time and consideration of issues that are important to the Down syndrome and disability community in Maryland.
Education. People with Down syndrome are always learning. They should be able to go to good public schools from elementary to high school and to college if they want. The Individuals with Disabilities Education Act, or IDEA, requires public schools to provide each student who has an individualized education program, or IEP, a free and appropriate public education, also known as FAPE. The federal government has committed to paying 40% of the average per pupil cost for special education, but has never met that commitment. Current federal funding is about 13%. Ask a federal candidate. Do you think the Individuals with Disabilities Education Act should be fully funded at the federal level as was promised when initially passed? Only about 20% of Maryland students with intellectual disabilities and 3% of those who take the alternate assessment are included in general education classrooms for 80% or more of the day. Most of these students are educated in self-contained classrooms or separate schools apart from non-disabled peers. Decades of research clearly points to the benefits of educating students with and without disabilities together. Ask a candidate. How can we better support districts, schools, administrators, and educators to create inclusive school communities and classrooms that provide the services and supports needed for all students to be successful? Pillar 3 of the Blueprint for Maryland's Future focuses on college and career readiness. All students, including students with intellectual and developmental disabilities, must be prepared for employment, post-secondary education, and community living. Ask a candidate. How can the transformation promised by the blueprint fully include students with disabilities?
Employment. People with Down syndrome and other intellectual disabilities can be successful in competitive integrated employment when given appropriate support and opportunities. In 2020, Maryland became the second state to eliminate sub-minimum wages for people with disabilities. Maryland is an employment-first state, which means all parts of our government are working together to make employment the first option for individuals with disabilities. Individuals with Down syndrome and other intellectual disabilities need more opportunities for integrated, competitively paid employment. Ask a candidate. Do you think that all people with disabilities should have the opportunity to work at a real job with competitive wages? What would you do to increase work opportunities for people with disabilities?
Healthcare. People with Down syndrome need equitable, high quality, and affordable physical and mental health care. Access to mental health care is a problem for many Marylanders, but it is particularly a crisis for people with intellectual and developmental disabilities. Many mental health professionals feel unprepared to serve this population, and many Medicaid recipients are unable to find professionals who will take on their care. Many children with Down syndrome have increased healthcare needs, but those from middle income families do not qualify for Medicaid or for waiver services. Alzheimer's disease is a public health crisis in Maryland. It is the leading cause of death for people with Down syndrome in the world, but there is no state level process in Maryland for tracking cases or specific supports offered to the DS Alzheimer's community. Ask a candidate. How would you work to increase access to mental health care for Marylanders with intellectual disabilities? How can we expand access to Medicaid to include more children with disabilities who need it? And what are your ideas to improve information about early detection and care for people with Down syndrome, Alzheimer's disease, and also their caregivers?
Home and community-based services. Home and community-based services, HCBS, and long-term services and supports should be readily available, easily accessible, fully funded, flexible, and implemented as soon as the need arises. Home and community-based services, HCBS, are important to adults with Down syndrome for them to live and work in their communities with the support they need. More funding is needed to stabilize the direct support workforce. Over the last year, individuals and families have faced many serious problems. Staff not getting paid or being paid late, people being wrongfully dropped from Medicaid, lack of responsiveness from the Developmental Disabilities Administration, and a lack of understanding about people-centered planning as the heart of defining the supports and services needed for individuals to live their best lives. Transitioning youth are also spending months without receiving any services or supports, putting incredible strain on families and young adults with IDD. Ask a candidate. Do you support increased funding for HCBS and stabilization of the direct support workforce? How can we recenter the dignity and rights of people with IDD at the DDA in its policies and work?
Housing. Adults with Down syndrome should control where they live, who they live with, what they do each day, and the opportunity to rent or buy their own homes. There is a shortage of affordable, accessible, safe housing for people with intellectual disabilities. More resources and attention by state departments are needed to address the housing support needs of people with IDD. Ask a candidate. How would you address the shortage of affordable, accessible, safe housing for Marylanders with IDD?
Informed choices. People with Down syndrome and other intellectual and/or developmental disabilities, IDD, are able to make informed choices about all aspects of their lives. Individuals with Down syndrome have the right to make choices and decisions with support. In 2022, the Maryland legislature passed a law making supported decision-making an alternative to guardianship and passed the Self-Directed Services Act that allows an individual to have choice and control of their Medicaid waiver services. Ask a candidate. How can we make sure that these efforts to restore and protect the ability of people with Down syndrome and other intellectual disabilities to make choices about their own lives are successful?
Justice. People with Down syndrome and other intellectual or developmental disabilities deserve to feel safe, understood, and included in the communities in which they live. The Ethan Saylor Alliance for Self Advocates is part of the Maryland Department of Disabilities. It promotes leadership by people with disabilities in the training of law enforcement and other public entities in Maryland. People with intellectual and developmental disabilities have the right to justice and fair treatment in all areas of the criminal justice system. They should have any supports or accommodations that they need for the system to be just and fair. Ask a candidate. Do you support the mission of the Ethan Saylor Alliance and the further development of policies and programs promoting fair and equitable treatment of people with disabilities when interacting with law enforcement and the criminal justice system in Maryland?
Transportation. All forms of transportation, including public transportation, provide a critical means for people with disabilities to access employment, education, healthcare, and community life. Mobility Link Paratransit, a service run by the MTA, provides transportation to people with disabilities who have difficulty using other types of transportation. Unfortunately, Mobility Link underperforms compared to the other MTA public transportation services, for example, bus, light rail, metro. Too often, riders are left stranded, are late to work, or miss medical appointments. Many adults in our community need paratransit, but only use it when absolutely necessary because it is so unreliable and complaints are not addressed. Ask a candidate, how would you hold MTA accountable for addressing these failures and living up to our state's commitment to people with disabilities?
Information for Maryland voters, November 2024 elections. General information, Maryland Board of Elections, Maryland Votes 2024. www.elections.maryland.gov/2024/index.html. Important dates. Last day to register online or by mail is October 15th. Early voting is October 24th through the 31st from 7 a.m. to 8 p.m. Last day to request a mail-in ballot, November 1st. An election day happening on November 5th. Did you know in Maryland we have same-day registration for in-person voting? You can register in person at an early voting site and on election day at your voting location. Voter registration. Who is allowed to vote in Maryland? Eligibility to vote. Go to elections.maryland.gov/voter registration/index.html. Did you know individuals with IDD are eligible to vote unless they are both under guardianship and found by a court to be unable to communicate a desire to vote? Register to vote. voterservices.elections.maryland.gov/online voter registration/instructions step 1. Check your voter registration. voterservices.elections.maryland.gov/voter search. And how to vote. Learn more about mail-in voting or request a mail-in ballot by visiting www.elections.maryland.gov/voting/absentee.html. Find your polling place, your voting districts, and your local Board of Elections by visiting voterservices.elections.maryland.gov/polling place search. Information about access by voters with disabilities. Visit www.elections.maryland.gov/voting/accessibility.html. Did you know you can bring any printed material, including your marked sample ballot, to help you vote?